In this video, I'm gonna talk about ankle sprains and the guidelines and steps to follow if we happen to twist our ankle. So I'm gonna start with an example. This is Maria. She's 25. She jogs and goes to the gym regularly, but she twisted her ankle on last jog. Her foot has swollen and it's painful when walking and to the touch, and she does not know what to do. She doesn't know if she should go to the doctor. She doesn't know if she should move the feet. She doesn't know if she should put ice on it. She doesn't know what to do. So we are gonna talk about the things that she could do so that you can take as an example and apply for next time that it happens to you. About the diagnosis. So I just want you to know that if you just rolled over your ankle and you don't have much pain or swelling, just take care of it for a couple of days and don't worry about it. However, if your feet looks something like this after you get back home from the run and it's swollen, it's painful when walking, now in this case we may need to take a different approach. So there's the moment of injury, which is when we twisted our ankle when we were jogging. Then about an hour later to a couple of hours later, we may start seeing some inflammation and some pain once our body cools down. And this is the factor that is gonna make us think about going to the doctor. Going to the doctor is gonna be necessary to differentiate if we've broken our foot or if we've just sprained it. So he's gonna apply the Ottawa rules, in which depending on your type of pain, where it is and how it is, he's gonna decide if you should have an x-ray or not. Another important thing is that against popular belief, fractures can be possible even if you can move your feet. So don't listen to all that advice saying that if you can move it, then it's not broken, because it's not true at all. You can have a broken foot bone and be able to move your toes or be able to move your ankle. So don't trust that. So when going to the doctor, one of the choices he has is to not ask for an x-ray, which again will depend on our symptoms and our kind of pain and where it is. If he decides not to take an x-ray on us, then the diagnosis will be a sprained ankle, in which case we will get sprain treatment, and this is what this video is for. And a sprain diagnosis may or may not include imaging like ultrasound or MRI to quantify the degree of sprain we have in our ankle. But it's not necessary. It can also be a clinical diagnosis. So the other option the doctor has is to ask for an x-ray, in which case we may have two different outcomes. We may not see any fracture, in which case we will get sprain treatment, or we can have a broken bone, in which case it's a whole different conversation, a whole different treatment, which we won't cover in this video. But as you can see, the idea is that we go to the doctor if we see this inflammation, because it's important to discard the option of having broken a bone. Then let's talk a little bit about the type of sprains we can have. So this is a normal ligament, the structure colored in green, and the red arrow represents the mechanism by which we injure it. So grade 1 sprains are consisting of slight stretching and damage to the fibers of the ligament. Grade 2 would represent a partial tear of the ligament. And grade 3 would mean the complete rupture. Now, as we said before, in the cases in which the diagnosis is purely clinical, we won't know the grade of the sprain. And also in certain grade 3 cases, the doctor may recommend rehab before considering surgery, because grade 3 sprains, depending on the case and the patient, can be surgical. And these are the mechanisms of injury. As you can see, our feet can go into what we call inversion, or turning inwards, which is the most common kind of sprain of the ankle, in which the lateral ligaments are affected. This is gonna be the most common one in 90% of cases. You just stepped wrong and your foot turned inwards. The foot, due to its anatomy and the way we walk, has a tendency to fall in that position. And then there's a version in which we are gonna sprain the medial ligaments of our ankle. This is way less common, usually happens more after going down a stair or stepping onto something, is way less common. And the treatment is gonna be similar. The main difference is gonna be which structures are affected and thus which movements are more painful. Before speaking about the treatment, I want to talk about something you may have heard before, some concepts which are the acronyms ICE, RICE, PRICE, or POLICE. You may have heard these as ways to remember what to do after an ankle sprain. I just want to say that none of those are up to date and they are not recommended. The acronym we are gonna use, and the most up to date, is called Peace&Love. So phase 1 of the treatment is gonna be more focused on protection. Again, we are gonna see more about this Peace&Love concept. So in peace, the P stands for protection, as in avoiding activities and movements that increase pain during the first days after the injury. So if you have to walk with crutches for a couple of days, there's no issue with that. You can do it. Try to avoid them if they are not necessary, but if by any means you can't step on the floor, use crutches, or a single crutch also. Then elevation. Elevate the injured limb higher than the heart as often as possible. Elevation is not something extremely scientifically proven, but it doesn't hurt to try it. There's barely any risk with it, so we might as well just try it. Then a very important part A of avoiding anti-inflammatories, and this both speaks for anti-inflammatory medications like drugs and icing. This is very controversial because doctors are gonna recommend anti-inflammatories forever. Icing has been recommended. We are gonna try to avoid them only in extreme necessity cases. Inflammation is a necessary part of recovery of the tissues, so we are gonna try to not disrupt that physiological mechanism. Then C of compression, using elastic bandages or taping to reduce swelling and improve motor function. The most effective ones seem to be semi-rigid bandages like the one you see in the picture, instead of more elastic and flimsy ones. The semi-rigid ones, as shown in the literature, seem to be the most effective. And E of education, just try to avoid unnecessary passive treatments, understand the injury as it is, and give your body time to recover. So I'm gonna propose you here a program in which from the first couple of weeks we are gonna start giving some attention to our ankle. We are gonna do some mobility exercises like we see in the picture. We can go with our feet up and down, we can do circles from it, we can go inwards and outwards. This is gonna be important to keep mobility going, but at the same time it's not gonna put lots of demand and pressure on the ankle. This is gonna help reducing inflammation, maintaining mobility, and reducing pain. And also we are gonna do some elevation and taping after the exercises as a daily routine, so we can get some more improvement. Our goals in this part of the treatment is to reduce pain and inflammation and to improve our range of motion. If we don't move our feet for a whole week or couple of weeks, when we get back into it, it's gonna be more painful. Recovery is gonna take longer. So I would advise to start moving as soon as possible. Then phase 2 is gonna rely on strengthening. Now, the love part of the Peace&Love acronym, L comes from load. Allow your body to determine when you can start loading, when you can start walking more. Just try to adapt to whatever your body is telling you in terms of making contact with your feet on the ground. Optimism, just try to think of it as a normal process that is gonna go well. Being confident and positive will improve the results. Vascularization, basically do some cardio to increase blood flow to the area. And exercise, which is gonna be the fundamental pillar of recovery to restore mobility, strength, and proprioception. Exercise is the single most recommended therapy for ankle sprains, so we might as well do it properly. So this is gonna take us 1 to 3 weeks, and this may merge a little bit with the previous weeks. The amount of time always depends on the pain. It's gonna fluctuate from person to person. So that's why I also kept a little bit of the things we recommended on previous phase. So we are gonna keep the mobility exercises and the taping and the elevation. But as you can see, the idea is to reduce taping and elevation for the first week until we take those two off of the program, since they are more passive and they are more recommended just to control pain and swelling. And the idea is that at this point, there's way less pain and swelling. And we are also gonna add strength and stability exercises. These are gonna be the core of our training. Exercises can be done with bands. Then we'll progress into bodyweight exercises like calf raises. And they will also progress into more lower body oriented exercises just to maintain musculature and coordination. And then I'm also gonna recommend low intensity cardio. In this case, try whichever you can do without feeling any pain. Static cycling or elliptical machine can be two great options. Also swimming. Phase 3 is what I'm gonna call advanced strengthening. This is gonna take 2 to 6 weeks. This is what we may consider almost full recovery. The idea is that we increase the load on the lower body exercises we are doing. We introduce more functional activities, more strength demanding activities, maybe some plyometrics. We increase the difficulty of our stability exercises, like in this case, using an unstable surface. And we may also start increasing the intensity of cardio. We may try running. If not possible, then we should take a step back and probably just do some kind of fast walking. Our goal in this phase is to achieve full recovery if there are no sports demands. So if you are somewhat a sedentary person, then in this case there's nothing more to do. But if you are someone active who does a lot of sports, then there's a last phase we need to talk about. And that last phase is what we call return to sport phase, which may take about 3 to 8 weeks, and the goal is to return to our normal sports demands to be fully adapted for our physical activity. The idea is we are gonna keep progressing all of the exercises we've been doing before, and we are also gonna add a lot of plyometrics and a lot of sport related exercises, adaptations of movement similar to what we may see on our sport. And also we are gonna try some high intensity cardio just to fully adapt to the activity we used to do. And that is pretty much how we would do it. So thank you so much for watching. If you have any question, you may leave it in the comments, or you may check a previous video linked here.